Hey everyone, it is your girl Miss B. Welcome to another episode of Health Talk. As I record this, the world is dealing with one of the biggest pandemics since the 1918 Spanish flu. Millions are sick, hundreds of thousands are dead, there are failing economies, and everyone is full of anxiety and fear. We all have fears, but some fears are extreme or irrational. In fact, what we fear may be totally harmless. What gives you nightmares? So, what are you afraid of? Today, the topic is phobias. We all have phobias. A phobia is a fear, but fear is not a phobia. Confusing? As we get deeper into this topic, this will become clear. In Barbados, depending on who you ask, people will say that they fear different things. For some, it's centipedes, lizards, the sea, lightning, especially during the hurricane season. For others, these fears are more deep-seated. There is the fear of the dark, fear of animals, example dogs or livestock, fear of small spaces, fear of flying, and so on. But what is a phobia? A phobia is extreme or irrational fear of or aversion to something. There are four main types: animal phobia, natural environmental phobia, situational phobia, example public speaking, being in a tight space, or being around large crowds. There's also blood injection injury phobia, or fear of surgery, needles, or seeing blood. In 2019, there was an entry of some new phobias. Phobia is the fear of being judged under constant scrutiny by friends or strangers alike online. Carbophobia, as the name suggests, a fear of eating carbs, a consequence of our obsession about weight loss and body perfection. Food neophobia, a fear of trying new foods. Eco-anxiety, a fear about consequences about climate change. And there's nomophobia, a fear I am sure most people have, especially between people that are 14 and 45, is the intense fear of being without your mobile phone. But they are not the most popular. Here are 7 of the most common phobias. There's the fear of heights or acrophobia, the fear of flying, which is aviophobia, fear of enclosed spaces, claustrophobia, fear of spiders, which is arachnophobia, fear of dogs, which is cynophobia, fear of needles, trypanophobia, the fear of germs, which is mysophobia. But how does it affect you? So how do you distinguish fear from a phobia? The symptoms are more long-term and somewhat extreme. Symptoms of phobia: you have sweating, trembling, hot flashes or chills, shortness of breath or difficulty breathing, a choking sensation, rapid heartbeat, pain or tightness in the chest, a sensation of butterflies in the stomach. Here are some crazy facts about phobias. Phobias can be hereditary. Yup, you can pass on a phobia via your DNA. Celebs have weird phobias. Famed film director Alfred Hitchcock had ovophobia, or fear of eggs. There are more than 400 phobias, and with the internet and social media, more are created each year. Most phobias start in childhood. In fact, it is rare for phobia to form as an adult. And women outnumber men in the categories of phobias. So can you cure your fears, or to be specific, your phobia? The answer is yes. You can use exposure therapy, a type of cognitive behavioral therapy, or CBT. How does it work? Well, the phobic person is taught different ways of understanding and reacting to the phobia. The therapy teaches the person to control their feelings and thoughts surrounding the phobia. Exposure therapy introduces gradual exposure to the phobia over a series of steps in order to gain control over the phobia under the guidance of their therapist. Alternatively, there is medication that can help with anxiety. Sadly, people with phobias can have other issues like addiction, substance abuse, and mental health issues, depression, insomnia, and panic attacks. If you have a phobia which is affecting your life, please seek help or talk to a trusted family member or friend about it. This brings an end to another episode of Health Talk. Next episode, Miss B looks at the latest news on HIV and AIDS. Remember, the secret to a great life is good health. Bye, everyone.